been now 10 or 11 years since the Women's Health Initiative was published. And more women are being concerned with their menopausal symptoms in our office.
I see the same thing. I see women coming in to discuss a number of problems, and the most common things I hear are problems with hot flashes, obviously, but also mood disturbance, sleep disturbance, problems with libido, sexual functioning, sexual desire, energy level, fatigue, and problems with weight management. Those are the main questions.
I have the same concerns from patients in my office. The nice thing is that those patients are coming in with questions of how they might be treated with hormone therapy.
I have patients actually who come to see me specifically to discuss this concept of bioidentical hormones. What is it? What does it mean? What can it do for me? And is this the right approach? So what sort of things do you discuss with your patients?
Well, first of all, I try to understand what they mean by bioidentical. Right. I ask them if they're more interested in hormone levels that they were having when they were in their childbearing years, or if they're more interested in solving the symptoms that they have, right. And that those may be two very different targets for medicines. I want to solve these symptoms that you're having with the lowest dose of the medicine that works. I'm not trying to recreate a 25-year-old woman. I'm trying to solve a menopausal issue with that
set of symptoms.
Yeah,
right.
Yeah.
So the term I think that gets thrown around a lot in sort of the popular culture, bioidentical, is supposedly something that's natural, something that's not synthetic, and something that's custom made for the individual patient. And I think that's where the attraction lies to a lot of people. I think one of the features that seems to be attractive about the whole idea of bioidentical hormones is the idea of customization. So consumers are told that a particular combination of hormones in particular levels can be determined based on certain testing. And the testing that seems to be the most prevalent is using saliva, measuring hormone levels in saliva. And I think most professional societies, ACOG and North American Menopause Society and Endocrine Society and the FDA and various other groups really have come out strongly against this whole notion that salivary hormone levels or hormone levels in saliva really have any utility whatsoever.
Absolutely. Not only do they not have utility, but they can provide very misleading information
exactly.
about what the levels in saliva are with what the levels in the blood are, and what those have anything to do with how the patient's feeling. One woman's relief at a level of 50 is another woman's relief at 150.
Right.
And because of that individual variability, then we concentrate on changing the doses in a way till they get relief.
Right, so it doesn't mean that the woman at 50 needs to be brought up to 150 if she's feeling well at a level of 50. I agree with that. One other concern that I have about the idea of behind bioidentical hormone therapy is that it's safe. And I think we really need to emphasize that that's based on no data, no information really. I think that's another thing that consumers need to know is these are not FDA regulated or approved preparations.
That's right.
And because of that, we don't know what the effective level is. We don't know what the safe level is. We don't know what the reproducibility is, so whether your Monday batch is equal to your Wednesday batch. And we don't know that there's not something else in the preparation, so the purity doesn't have to be demonstrated. And the distributors are not required to collect information about adverse events, adverse outcomes, dangerous results, unlike prescription medications are required.
To my understanding, almost everything that can be obtained without a prescription, which has been tested against placebo, has worked about the same as placebo. And placebo works about a third of the time. So it's powerful medicine. But it doesn't mean that it's solving those menopausal symptoms in a safe, effective way over time.
There obviously is a lot of information on the internet, and I caution my patients about what they read and trying to be educated consumers and realize that information coming from a website that's trying to sell you a product has a certain degree of bias to it.
I'd say a lot of bias to it.
So my one word of advice to my patients is caution. Don't believe everything you read. Don't believe everything you hear. If it sounds too good to be true, it probably is.
I couldn't agree with that more. Catherine, it was great fun. It's been an amazing roller coaster, hormone replacement therapy, from before the Women's Health Initiative to after the Women's Health Initiative to now. So it's nice to be able to talk about these things again.
Thanks for sitting down and going over this. I think it's really useful information for people to have.
Me too. Thanks so much.